number one issue people vote on is jobs and the economy. That's whether you're Democrat, Republican, black, white, rural, or urban. The number two issue people vote on is safety and security. What folks unfortunately don't vote on is health. And now, anyone with a phone can pull out the Gallup poll, and you may say, well, health care is in the top 5. But I would argue that people still aren't voting on health. They're voting on the fact that they're going bankrupt. They can't pay their bills because their medical bills are so high. So it's still essentially an economic motivator for them. What I'm doing, number one, as Surgeon General, is working on a report on community health and economic prosperity to show the link between communities that invest in health and their subsequent economic successes. To give you another reference, which may resonate with folks, everyone's talking about where the second Amazon headquarters is going to go. You hear cities all over the country competing for it. Well, the number one cost for Fortune 500 companies in general is salary. The number two cost for most Fortune 500 companies is healthcare. Amazon's not going to move their second headquarters to a place that has high obesity rates, high smoking rates, high diabetes rates, and it's going to drive up their number two cost when they move to that town. So we need to demonstrate that link between health and economic prosperity so that we can get private industry, we can get citizens, we can get mayors and county commissioners to see that we need to invest in complete streets, that we need to invest in making sure grocery stores are in communities that have previously been food deserts. We need to invest in clean air laws. Healthcare professionals, doctors, nurses, pharmacists are among the most trusted people in the country on any issue. Folks trust us. And so we need to make sure our voice is heard in our communities and that we're pushing for these public health interventions that we know ultimately will lead to better health and it cause us to have to spend less money on health care, but ultimately it will also allow us to spend our time and energy and money and funding that we do devote to health care more efficiently, more wisely, and that we'll be better able to do the things that make us feel satisfied. You know what's not satisfying as a physician? Helping 10 people, but feeling like there's 100 more waiting outside in the waiting room or in the lobby. That overwhelming line of folks to be treated is causing physician burnout. And one way to treat physician burnout is to get upstream and to lighten their load just a little bit. One of the things that we're putting out in the next few weeks is a request for information from the Office of the Surgeon General, looking for best practices around the country where folks have partnered with the business community and with other communities to promote community health.